Hello everybody, this is Victoria and this is going to be my discussion board response for exam 2. So for exam 2, I went ahead and selected the two topics, cardiac responses to acute resistance exercise as well as cardiac responses to chronic resistance exercise. So when we think about resistance exercise, we're going to go ahead and relate that to our anaerobic exercises or anaerobic training. So for a refresher, anaerobic training basically relates to anything that is high intensity, intermittent bouts of exercise such as weight training, speed or agility exercises, as well as interval training. So just to keep that in the back of your head for both of my responses. So for question 1, the cardiac responses to acute resistance exercise. Now, because the body is going from rest to steady state in an instant, our body is going to respond, or specifically our cardiovascular system is going to respond by increasing many components such as our cardiac output, our stroke volume, heart rate, oxygen uptake, systolic blood pressure, and most especially the increased blood flow to our active muscles. And basically all this is commonly in response to an athlete or an individual who's exercising and using the Valsalva maneuver. So for those who need a refresher on what the Valsalva maneuver is, it is the action of attempting to exhale with the nostrils and the mouth when the glottis is closed. So basically this is just a common breathing technique that is used in exercise to try to lift heavier weights. So that is question number 1. And for question number 2, cardiac responses to chronic resistance exercise. So as the body is becoming adapted over time, we are starting to see a decrease or no change in resting heart rate and blood pressure, being that the body has been adapted to this type of exercise. And again, resistance training or exercise does alter the cardiac dimension. So that's also another note to keep in mind. Now, another note that I have here as a cardiac response to chronic resistance exercise is that chronic resistance training also reduces the cardiovascular response to an acute bout of resistance exercise of a given absolute intensity or workload. And basically, as I said, as your body becomes adapted to this type of exercise, so resistance exercise or resistance training, we are going to see many benefits of our overall health, including a lower risk for hypertension, an improved cholesterol, a decrease in chronic inflammation, improved insulin sensitivity, and then, as I mentioned, our improved quality of life. So that goes ahead and concludes my responses for this week's exam. Thank you.